Hi everybody, welcome to Healthline. I am Gregory Zarian. So summer's here. Have you spent more time with your friends, your family? Are you spending more time out in the sun and in the water and in the woods and in the mountains? And are you doing more? You know, with it being a lot warmer and not so much rain and it being so cold, we spend more time outside. And have you noticed how much you're not really on your social media? Go outside and enjoy your life. Put down the phone and be with your family. You know, one thing I love about being part of Healthline is its mission. And its mission is just whole person care. So put down the iPad, put down the phone, and get involved. You know, being healthy is a conversation. So get healthy with your family. Go out, get out, and enjoy your life. Now, with it being summer, with it being more activities and more back and forth with friends to and from, there's probably a lot more injuries and wounds and sunburns, as we just aired last time, emergency care and what to do if you get into trouble, and dehydrated and what to know. Summer, wounds, cuts, scrapes. So we decided to bring you the best of the best from Glendale Adventist Medical Center, Dr. Bill Khoury. He's a wound specialist and also started in emergency care. How are you, doctor?
I'm doing very well. Pleasure to be here today.
So glad you're here. How was that intro? Did I get to it?
It was excellent. Yeah. And I actually, I trained in emergency medicine. I've been practicing emergency medicine for over 15 years. And more recently, I became more interested in wound care and hyperbaric treatment. And that's what I've been performing actually for the past 8 years as well. There's just a lot of need in the community, and it's something that I'm passionate about.
Well, what I love is there's so much conversation about hyperbaric care. Tell us a little bit, because you're new to Glendale.
Yes.
You come from the OC. Share with us a little bit about your medical history.
Yeah, so basically after completing residency in Los Angeles, I moved to Orange County, and I worked at several emergency medicine locations in Huntington Beach and Laguna Beach. And we saw a lot of injuries, lacerations, you know, various, you know, other conditions. But more recently, over the past 3 months, I was recruited to come to Glendale Adventist.
Welcome.
Thank you so much. I'm very, very excited to be here. It's an amazing medical center, amazing staff as well, really state-of-the-art facilities as well. We have hyperbaric chambers that are actively treating patients now, and we're really looking to grow the program over the coming years.
Well, we've heard a lot of hyperbaric treatments.
Mm-hmm.
We're going to address that when we come back, and also, but you know, you make a comment about emergency care and wound care, so I'm going to bring it back to you. What is the difference, because you know I love a great cliffhanger, what is the difference between a wound, a laceration, and a cut? And between now and when we come back, take a deep breath in, and a deep breath out, get a glass of water, get a carrot stick, and join us on the other side. More on Healthline when we come back. Welcome back to Healthline. I'm Gregory Zarian. Before we address my cliffhanger, Glendale Adventist Medical Center will be getting a new name. Did you know that GAMC is part of a 20-hospital system called Adventist Health in California, Oregon, Washington, and Hawaii? GAMC's new name will be Adventist Health Glendale. If you've not already seen, you will be hearing more about us. You'll also see them in commercials, billboards, publications, on the internet, and all over the country, and now locally here in Glendale, because it's all about your health. They're still your old friend. We're still your old friend. We just got a new name, a new look, with our same mission. Now, the conversation today is all about wound care, and we also dropped in hyperbaric treatments. Joining us from Glendale Adventist Medical Center is Dr. Bill Khoury. And before the break, and I hope you had a glass of water, carrot stick, and did a few deep breaths, I asked you, what's the difference between a wound, a cut, and a laceration? Okay, Dr. Khoury.
Yes, so basically a cut and laceration would be pretty synonymous. So both are acute events.
Now, what does that mean, acute events?
So it's something that just happened. So it may have been a day, two ago where there was some usual trauma. And you know, a cut or a laceration, which are pretty synonymous.
Like if I walk into the side of something sharp,
right?
That's a cut. Is that a laceration as well?
Yes. So both are kind of interchangeable, I would say.
Okay.
So a wound.
But is one worse than the other?
No, they're both pretty similar. So I would say, as far as a cut and a laceration,
okay.
I would say generally a laceration is more the medical term for a cut.
Okay, so then
they're both
for those,
pretty synonymous.
Okay, for you at home then if if you get hurt and you cut yourself and you hear from the nurse or the doctor or whatever, there's a cut or a laceration, they're one and the same. But now when we talk
Exactly.
about a wound,
Yes, so
it sounds more severe.
It is. So in general, the types of treatments that we were doing in an emergency department would be usually for cuts or lacerations or acute, lacerations, for instance, that would occur within a day or two.
Okay.
The types of wounds we're treating at the wound care center typically are having a hard time healing. They've been there for longer periods of time, and a lot of times we'll call them ulcerations.
Okay.
So you may hear that term at wound care centers, which is you have a chronic ulceration. The difference mainly is because they're having a hard time healing for various other reasons. So it may be a wound that hasn't healed for a month, 2 months, and sometimes I've seen some that haven't healed for years, sometimes over 10 years, remarkably.
One wound.
One wound, correct. And usually there's a constellation of reasons why that would occur. Commonly diabetes, I would say, is number one.
Somebody that is diabetic gets, and when I say a wound, could it be a cut or a laceration, or is it more of an open sore? Is it more of something that gets more infected?
Yeah, that's a good point. So initially, if let's say a diabetic has an acute cut on their leg that occurred a day ago, we would need to be more aggressive at treating that, we know, because that could turn into an ulceration that is, we would say, non-healing or not healing over a longer period of time because of things like, we call it diabetic neuropathy. Their nerves are not working very well. Also, their circulation may not be as good too, so their oxygenation to the area is poor, and that may turn a cut or a laceration, which is usually will heal just fine within a matter of maybe a week or two, to an ulceration or a chronic wound that has not healed, sometimes again for over a month plus. So it needs definitely more aggressive, a different type of treatment, and that's what wound care centers can offer.
Let me back up just a little bit, doctor.
Sure.
So when we first started talking, you said that some of your history is in emergency care.
Correct.
At Glendale Adventist, there's urgent care and an emergency room. So if somebody has a cut or a laceration, do you invite them to go to urgent care? I mean, they can go to both.
Yes.
But which one would be quicker and
So it depends
easier?
probably on the complexity of the cut. So sometimes there are relatively small cuts that can be receive excellent and adequate treatment.
Let's break it
So,
down.
sure.
I'm at the beach and I trip and I fall and there's a piece of glass sticking out of the sand and I cut myself.
Yes.
Take myself to.
So urgent care is absolutely appropriate, and they'll do an excellent job of treating you there. A lot of times they'll require x-rays to make sure there's no glass, residual glass inside, and they can suture that as well. So they're fully prepared at treating that type of scenario at an urgent care. Yeah, in an emergency room setting, sometimes if it's a more complex laceration that's larger, maybe down to the muscle layer.
Okay,
And it
but
requires-
surface skin-wise. Okay, so let me stay.
Sure.
Cut myself a piece of glass, couple stitches, or maybe no stitches at all.
Sure.
What is treatment for that? Because a lot of people think, I mean, there's a whole, yes, please keep it open, please keep it covered.
Yeah.
Put Neosporin or an antibiotic on it. How do we do that?
So that's an excellent question. I
you.
get that question almost on a daily basis. Generally, for open wounds, we want to keep them covered. There's several reasons for that. Mainly is to prevent bacteria from migrating inside the wound and causing an infection. And wounds tend to heal faster and better when they're covered, so that's been looked at.
But
So
is it okay to leave it open a little bit just during the day?
generally, after a wound has opened up, we like to cleanse it and use some type of, typically early on, antimicrobial, so some type of antibiotic ointment on it. Just to
Give me
reduce
some
the risk of
examples.
infection.
There's
Bacitracin, triple antibiotic ointment, Neosporin is something that can be used. And then just cover it with a simple dressing. We typically do not like to leave a wound uncovered, so we generally will want it covered at all times, day and night, until it's completely closed over with new skin or healed, like a laceration would heal from skin to skin.
And the only moisture that you invite to be on there would be the.
The ointment itself actually will cause some moisture to be on the wound, and the covering itself, there'll be a little bit of drainage that comes out, so that'll add some moisture to the area.
And then you just change the bandages.
We change it. So typically, let's say if there was a laceration or a cut that occurred, we'd want a dressing to be changed once a day. A
Okay.
couple reasons. One is we can look at it to make sure there's no infection developing, and the other, we want to make sure that we want to reapply an ointment and antimicrobial on it to reduce the risk of infection again.
Thank you, doctor.
Sure.
More with wound care and Dr. Khoury when we come back. Don't go away. Welcome back to Healthline. The entire conversation is all about hyperbaric medicine and also wound care. Joining us is Dr. Bill Khoury from Glendale Adventist Medical Center. Dr. Khoury, you were sharing with us how to take care of a cut.
Yes.
To keep it dry, but only, and keep it covered, to apply antibiotic ointment.
Correct.
Since it is summer season, what do you invite us to have in our emergency kits?
Yeah, so I think probably something like some type of antimicrobial ointment or cream would be a good idea.
So Neosporin.
Neosporin, bacitracin, or
Okay.
triple antibiotic ointment would be a good idea.
What about hydrogen peroxide?
Hydrogen peroxide is good, so we usually will use that when the cut initially occurred,
Okay.
just to reduce the bacterial, I
Perfect.
guess, bioburden that develops in the wound. But after that, we typically will avoid using that on a regular basis because it can delay healing of wounds because it reduces some growth factor production. So
Okay.
the answer would be yes, absolutely. We use something like hydrogen peroxide.
What about
would be
alcohol?
good. Alcohol is not really necessary. It kills bacteria really well, but it's
People
quite
use
painful.
both, and I just want to know the distinction
Yeah,
between.
they both are pretty comparable at killing bacteria. I
Okay.
would say both will do a great job of killing staph aureus,
Okay.
MRSA, which is resistant staph. The only, I would say one of the main differences is hydrogen peroxide is a little more comfortable to use.
Okay.
And if I got a cut, I would reach for hydrogen peroxide before reaching for alcohol. There's no alternative. Obviously, alcohol, could be used, but it's just more painful and not really necessary. So.
Okay, and then depending on the length or width of the cut, be it a Band-Aid or gauze, and just keep it dry.
Yes, correct.
Okay.
Yeah, and generally, if you have a significant cut that needs to be sutured, it should be done usually within 12 hours. So you don't want to wait longer. So if you
Yeah, and don't do it on your own.
Yeah.
If your mom pulls out the sewing needles and gives you that look, you're like, no, I'm going to my local urgent care.
Exactly. Yeah.
Let's go back to wounds.
Okay.
Bottom line is, what is a wound?
So basically, as a wound is any time you have a piece of your skin that's lost, or we would call it the epidermis medically, which is the outer layer of skin. So whenever that tissue is lost, there's a risk for infection developing. Depending on the depth, sometimes it could be a serious infection, sometimes it's down to bone, and a bone infection can develop. So for the types of wounds that we see, they're typically more complex, and we need to be very aggressive at healing them because the skin is our main barrier to prevent infection. That's number one. And so when any skin is lost throughout the body, bacteria inevitably will migrate over that open sore, and then an infection can be seeded. So it's something that needs to be treated early and aggressively.
And earlier you made a comment about something going to the muscle.
Yes. Yeah, so sometimes if wounds are deeper, they're at higher risk. So the closer the opening in the environment is to deeper structures in the body, we get more concerned. So if there's tendon or ligament exposed, if there's joint exposed, nerves, or definitely bone exposed, those sites can become infected. And it's on a different level than a simple soft tissue infection, or medically we'd call that cellulitis. When you get a bone infection, which we call osteomyelitis, that's something that's quite serious and requires usually IV antibiotics and bone debridement.
Well, my
so
twin
it's on
brother
another level, so.
actually was at Glendale Adventist.
Okay.
He was in emergency.
Mhm.
Shout out to all of you, Dr. Cardillo and your team, amazing. And also to the entire team at Glendale Adventist Medical Center. Put him on a really strong IV for cellulitis,
Yeah.
antibiotic,
Mhm.
and really took care of him.
Mhm.
And a lot of people don't realize how bad an infection can be.
For sure, yeah. It can get out of control and ultimately can even lead to sepsis or a blood infection, where a patient's health, and their lives could be at stake. And for patients that become septic, their blood pressure drops, they can become unconscious, and so.
Well, he was sweats, fever,
Mhm.
and it would come and go. You were talking about diabetes and wounds, and what are signs and symptoms, even if you are or aren't diabetic and there's a wound? What does someone have to look for in regards to something that's happening to you physically? this is bad, I've got to go to the emergency
So
room?
great question again. So basically, if somebody has increasing redness around the wound itself,
Is it immediate or it slowly starts?
It's usually over about, I would say, 24 to 48 hours
Okay, redness,
afterwards.
okay.
If you see redness around,
Bright red or dull?
usually brighter
Okay.
red color with increasing warmth. So
Okay.
that may be hard to determine, but you can compare it with another limb. Let's say it's on your arm, compare it to your other arm and just feel and see if it's more
Or just have someone
warmer than the
check.
other.
Go,
Have
does
someone
this
check.
seem really warm? And like if if there's something here, check here, but then see how much heat is radiating off.
Absolutely.
Okay,
So,
great.
and then increasing pain is another sign of infection. So it becomes, obviously the wound is painful itself, but if the pain is worsening over the first day or two, that really should not happen. Drainage is another one as well. Increasing drainage, especially colored drainage, yellow, green,
Not good.
brownish drainage,
Okay.
absolutely. So that tells, typically when there's an open wound that's not infected, it'll be a clear drainage. We call it serous drainage. So it's like a straw yellow color.
Okay.
But if it suddenly becomes cloudy, either cloudy yellow or green or brown, we know that there's some infection starting to develop, and that's something that needs treatment right away.
Now let's also talk about looking for the line going up to your heart.
Yeah, that's another good observation. So we call that lymphangitis whenever there's a...
When I say line, the red line, like
Yeah.
it's you have the incision and then you see this.
Correct,
map
absolutely. And
going
that is
straight up.
a clear-cut sign of infection.
Okay.
It's basically the lymphatics taking away tissue from the leg, and the lymphatics have become infected themselves, and you see this red line of demarcation emanating towards the central area of the body. We know for sure when somebody has that the infection is starting to spread up, towards the body and needs to be treated, again, very aggressively with usually IV antibiotics in that scenario.
Thank you, doctor. Please don't go away. When we come back, all you need to know about hyperbaric oxygen therapy and hyperbaric medicine. Don't go away. Welcome back to Healthline. Joining us today is Dr. Bill Khoury from Glendale Adventist Medical Center, specializes in hyperbaric medicine. So we've talked about wounds, we've talked about cuts, we've talked about what you need to have in your first aid kit.
Yeah.
What is a hyperbaric chamber, doctor?
So hyperbaric chamber is a chamber that we use to improve the tissue oxygenation for wounds that are not healing. And essentially, it's an enclosed chamber.
But that's also going back to people, as you were saying earlier, with diabetes and chronic sores that are not healing at all.
Absolutely.
Okay.
So that's our mainstay of the patient population that we're seeing for this particular treatment. It's an enclosed chamber filled with 100% oxygen under pressure. So for those that are divers, it's we pressurize to 2 atmospheres absolute, or 2 ATA. So it's a relatively minimal amount of pressure, but it improves the absorption of oxygen into the lungs and throughout the body. And so for those wounds that need more oxygen to help the body do what it needs to do, it'll provide that to improve somebody's healing capability. An example would be a diabetic, where they have a diabetic foot ulcer, and their circulation is compromised because of the diabetes. So the oxygenation around the wound is just not adequate, and it just will not heal because of that. And so the oxygen treatments will help raise up the oxygen level around the wound and to the wound itself to really allow the body to build the building blocks of new tissue.
So does it kind of like cut past, I don't want to say the infection, but it cuts past
It
the
does.
wound or the sore, and it's putting back oxygen that your body's not getting to the area.
Absolutely. So usually when somebody's circulation is compromised, our oxygen is it's based on what our red blood cells can make
Okay.
to get to the area. And so this bypasses red blood cells. It goes into the plasma, and the plasma can diffuse very nicely into soft tissues throughout the body. So it doesn't really require red blood cells. In fact, if somebody's in the chamber and has all their blood removed, they can still survive and live. And so,
That's fascinating.
yeah. So essentially, it really is an essential treatment for certain types of wounds to really help them to progress and heal. Otherwise, they're just going to develop some of the complications we talked about.
How long is the treatment, or does it vary depending on how?
It varies. So I would say the majority of treatments are 90 minutes, so it's not short. And so it's about an hour and a half that they're actually in the chamber itself. There's a pressurization and depressurization time, which is relatively
Your whole
short.
body's in there.
Correct. Your whole body's in. Now there are windows, and so you can easily
So you're not
see.
claustrophobic, okay.
You're not, yeah. And there's actually, at most centers, at our center at Glendale Adventist, we have a TV. Most patients watch
Music.
TV or sleep. Yeah, music. They can listen to music. And they also have a speaker system. So
Okay.
we have techs there all the time. They can communicate with them and make
If
sure
they
they're
have to
feeling
get out
okay.
and use the restroom, is that possible, or is it 90 minutes set?
It's 90 minutes
Okay.
set, but they can definitely come out early. So if there's
Okay.
an issue, which happens, if someone needs to use the restroom or for whatever other reason, they can be depressurized and removed from the chamber as well.
You know, we were talking earlier about, is this treatment good for people that have had cancer and like radiation treatments and stuff like that? Because, you know, if you have cancer and radiation, that site is not so much available to other treatments.
You're absolutely correct. So for patients that have had radiation to cancerous type lesions, like they've had squamous cell or basal cell carcinoma, or prostate cancer, like we were talking about before, if somebody's had prostate cancer and they received radiation treatment, it's very common for them to have injury to their bladder lining and they get bleeding, sometimes even 10 years down the line. And that bleeding is very hard to stop, and the radiation actually improves the oxygenation to the bladder itself for the body essentially to heal itself or heal the lining, and the bleeding should stop from there. It's very effective you know, for that particular problem. So for radiation-induced soft tissue injury wounds, that's a good percentage of our patients that we treat is just for that.
So I'm super healthy. Would it benefit me to come in and get a hyperbaric treatment?
So the answer to that is no.
Okay.
Even though there's a lot.
Because, you know, everyone's like, oh, I want to try that. And
I
there's,
know.
you know, there's oxygen and,
Yeah.
you know, there's also cryotherapy, which is putting you basically in freezing,
Right.
like a freezing chamber.
Right. Yeah, so it's definitely, there's a lot of information out there saying
Okay.
that hyperbaric oxygen is effective for other things. It just doesn't have good evidence behind it.
Okay.
There may be some use in other conditions that we just don't know that it's beneficial for, but essentially for, you know, medical centers and for science, we have to go by what's evidence-based. So there's really no evidence behind it being useful for things like autism, for things like strokes. There's a lot of other conditions for general well-being that you know, patients, you know, want to have treatment for, and there are cash centers that do provide treatment regardless of, you know, what the reason, you know, they're looking for treatment or seeking treatment for. But there just isn't good science behind it being used for general health, for things like autism, strokes, for a various myriad of other things as well.
In regards to someone that is getting treated hyperbarically, is that the correct?
Yeah.
Once you get out of the chamber and then you have another appointment in a week, what is my physical therapy? What is my homework at home in regards to getting better and healing?
So usually we kind of determine that. So for a new patient, we don't put them in the chamber right away. We initially evaluate them at our wound care center, and then we kind of put together a plan for them essentially. A lot of patients, they require various other things that need to be done. They may have some protein malnourishment, which delays wound healing. They may need improving their pressure relief. Let's say they have a diabetic foot ulcer.
Well, quickly in regards to protein, what are
Sure.
healthy ways to get protein? Because we
So-
all need protein.
Yeah, absolutely. And so if you have a wound, you need about 1.5 times the amount of protein you would
Some more
normally
protein.
take. More protein,
And
yeah.
you know, and there's a big conversation now about people being vegan. So
Mm-hmm.
find out your best sources of protein if you have a wound.
Absolutely.
Okay.
So, and there are plenty even for vegans. You know, nuts. There's
Garbanzo beans.
Yeah,
Lots of
garbanzo
protein.
beans,
Okay.
tofu. You know, avocados are a good source of protein. Beans are a great source of
Okay.
protein. So
And then if you're not vegan, chicken, fish,
chicken,
as healthy as possible.
Chicken, fish,
Okay.
absolutely. Eggs are a great source as well. So there's a lot of protein out there, and it's important for them to just increase the amount that they're taking in throughout that period where they have a wound.
And then again, real quickly, in regards to what I do when I'm out of the chamber, is it just getting as healthy as possible and creating that health recipe with my doctor?
Correct. So
Okay.
basically, we give them a plan with regards to what other things that they can do to help, you know, keep the healing progress going. So we'll be monitoring them throughout the whole period. So usually every week we'll evaluate their wound, make sure that it's getting better, making sure that we're seeing the signs of healing that we need to see. Making sure that they're compliant with doing what they need to do as well. So, but it really depends on the type of wound they have with regards to what specific treatments we prescribe for them.
And in 10 seconds, what's the best way to take care of your skin, doctor?
It's actually, as dermatologists would tell you, SPF, skin protection, and moisturize. Those are probably the top 2 things that you should do to keep your skin as healthy as possible.
Well, we at Healthline are so happy that you're here. Thank you for leaving the OC and coming here, and thank you for sharing with us all we need to know about wound care and how to take care of ourselves. Dr. Khoury, thank you so much, and thank you for telling us the difference between cuts, lacerations, wounds, and bottom line is just being healthy and paying attention. So the most important thing, bit of information we offer to you all the time, is about you and your health. It's summer. Have a first aid kit. Have hydrogen peroxide, Neosporin. You learned today to keep a wound covered. And if you're suffering from anything of like an incision and it keeps on getting warmer and more red and there is a line going up towards your heart, go to urgent care, call your doctor, go to the emergency room. Our mission here is to give you all the information you need to know, so pass everything you learned on today to your friends and your family. We at Healthline want you to be the healthiest you can be. So please remember to watch us on YouTube at GAMC Healthline. Follow us on Facebook at Glendale Adventist. Find us on Twitter at GAMC Health and also on LinkedIn at Glendale Adventist Medical Center. We got a new look. Same heart, same home. I'm Gregory Zarian. It's a pleasure. See you next time on Healthline.